So he's the one that is supposed to save us. I mean, he's surrounded himself with incompetent, unqualified people who are anti-vaxxers. And the whole anti-vax thing makes me particularly insane because it's been debunked, as I said. I learned that in my fellowship. It's been totally debunked.
Hi, Susan. Here
Hi,
we
Jan.
are with another episode of Just the Facts with you and me. And I was really excited to be able to talk to you today because your background in science reporting is really relevant. I know you watched all of the hearing this morning with RFK Jr., and I'm going to only refer to him as RFK Jr. because I don't want to dignify him with the name that I associate with uh, President Kennedy and Senator and Attorney General Kennedy, and not with the person who the Kennedy family has disowned. So he's
Right.
RFK Jr., or maybe just Jr. So tell me your biggest takeaways from the hearing this morning on vaccines and on the general management of his department and especially the CDC.
Well, it's chaos. I mean, it's typical of Donald Trump. It's chaos. It was infuriating. It was confusing. I came away thinking our politics are just so broken here. How this man got put in this position, who's in charge of our health, it's devastating. He could not even admit that the vaccination worked, and he couldn't name how many people it saved. He was so. Oh, plus you did hear about the breathing thing. Did you hear about that?
No, I didn't hear about
Oh,
that.
so while I listened to all 3 hours,
Yeah.
all of a sudden I hear like someone. It's almost like someone fell asleep and was snoring, and I thought maybe it's one of the really old senators that actually fell asleep because that's happened before. But actually,
Donald
Nicole.
Trump has fallen asleep in court.
Exactly. So, but today Nicole Wallace said it was RFK Jr. breathing because his microphone was on. Don't forget, everybody else mutes their microphone when they're off. And I thought it's someone with an open microphone. It was him. And he sounded like almost like asthmatic. Either that or like he was snoring and sleeping. I mean, it was very distracting. So that was just
Well,
another thing. So,
I
and
don't want to
like
discuss his health.
right,
That's not an issue that I think is important here. What I think is important is what he said and what he didn't say, the things that he answered and the things especially that he didn't answer or that
right.
he admitted he didn't know. And the shock of the senators on both sides of the aisle saying, and you didn't know how many people died from COVID? That's
Right,
a simple
right,
fact. How could he
right.
not know that over 1 million Americans died from COVID? So I think that those are important facts. But tell me more about what you thought.
So he basically, the gist of what he said today was that the COVID vaccine was more dangerous than COVID itself, which is ridiculous because let's
And
remind.
could I just say, he said at the same moment, but Donald Trump deserves a Nobel Prize,
Right.
not a
No,
Nobel Prize,
no,
a
right.
Nobel Prize for having done Operation Warp Speed, which a lot of people would agree that that was an amazing
Even Bernie
accomplishment.
Sanders said that today. Everybody tried to get RFK Jr. to agree. And he did in a kind of a double talking kind of way where he said, well, that vaccine, which was geared for this COVID epidemic, kind of worked. Or I mean, he had to walk around
Yeah.
that one too.
Yeah.
But let's remind people that, we lost over 1 million people in the pandemic and that many people still have long COVID. And the
Yes.
vaccine not only helped prevent people dying, but it helped severe COVID and it helped the long COVID. And I think there are 20 million people now diagnosed with long COVID. So bottom line, he can't be trusted to run our public health. I mean, and when he says to get rid of the mRNA vaccine, which let's remind people that's one of the things he wants to do, and we'll go through a list of what the bad things he's doing. But mRNA is not just about COVID. It's about bird flu. It's about other viruses. It's about future pandemics, chronic illness, diabetes, HIV. I mean, it's devastating to get rid of. I mean, it's scientifically proven, that it's a big scientific achievement of all time. And he's just going to cut it back.
He has
So,
cut it back, and he says, well, no, I'm going to give back money. But it's still a net loss of $50 million. So
Right.
it is a serious detriment to significant scientific accomplishment and to the future of protecting people. I know people who were in studies that may die because
Right.
of this cut in funding. And so it's a really terrible thing that he has done. And
Someone I know posted something about a child, someone they know who's a pediatric brain cancer patient who the funding's been cut.
yeah,
They can't continue the clinical trial that was working. I mean, how horrendous is that? Um, so he cut back on the mRNA vaccines. He fired like 20,000 people. Um, he's he was focusing, telling the public what he wants to focus on is the horrible amount of chronic disease and that the Americans are so unhealthy. And that's partially true, by the way. I mean, we are not the healthiest, people in the world, but in that Americans have lost faith in the CDC. So he's the one that is supposed to save us. I mean, he's surrounded himself with incompetent, unqualified people who are anti-vaxxers. And the whole anti-vax thing makes me particularly insane because it's been debunked, as I said. I learned that in my fellowship. It's been totally debunked. I can't imagine. He says he's coming out with a study. I can't imagine what that is.
well, he's coming out with a study supposedly that will link autism to
Right,
vaccines, which of course has been debunked. He is hiring people who have a severe bias and possible conflict of interest. He has fired the people who have led us to the accomplishments we've achieved and has put in their place people who are anti-vax, who have a political bias against it, not necessarily doctors, people who are just interested participants. And
right.
like him, he's not a doctor, but he believes for some reason that vaccines are bad, and he is going to make sure that people can't get it. He denied, by the way, did he not, that he was interfering with people getting the vaccine. That isn't true, is it?
It's not true at all. I mean, it's not theoretical. It's absolutely true. He controls who the insurance companies pay for. By law, the insurance, the CDC, whatever recommendation they make, the insurance company must cover. And that was done through Affordable Care Act and some other laws, but only the CDC can make legally binding recommendations. So, all these doctors are saying, okay, let's go to the Academy of Pediatrics and see what they recommend. Well, it's great what they're recommending, but it's not legally binding. So he's basically installing people who are going to make it harder to get vaccines, even though he said, remember in his hearing, he wouldn't do that.
Yes. Let's talk a little bit about the questioning and how you thought that went. There was one point where I was listening, and Michael said, "Is that a Democrat?" I said, "No, that's a Republican." There were a couple of Republicans who you couldn't tell were Republicans. Some of them you knew were going to support him
Right.
and say whatever he wanted them to say. Um, and one took an interesting approach of, "I'll submit questions to you. Here's what they're going to be," which meant he didn't have to squirm and
Right.
say, as he did to so many questions, "I don't know," or "No, I don't know." And so let's talk about how the questioning went and how he responded, because I found him to be completely offensive. He was so disrespectful of senators and said things that no one should say to any person they're in conversation with, let alone to a member of the Senate. What
Right.
did you think?
I thought so also. I think he was talking to Tammy Baldwin, and she was talking about in Milwaukee that the kids there's a lead crisis, and 1,800 kids had to leave their schools, and they called the CDC for help, and they couldn't get help, and there was no one who answered the phone because of
Because
mass
he
fire.
fired everybody.
Right. But he basically said to her, and I think to Maggie Hassan
Hassan.
from New Hampshire, um, that they were lying, it's not true what you're saying. You made this up or whatever. He was really disrespectful. It
And he
was
said, "You're talking gibberish," to one of the
right,
senators who
right.
was not talking gibberish. He was talking perfectly clearly. And then he went, "I can't hear you," when it was
Oh
clear to
yeah,
everybody that he could hear. Um, it, I thought it was really, really awful. I thought the senators, for the most part, did a really credible job
They
of
did.
questioning him, and that he did a really not credible job, except he did appeal to the president, because the president likes people who talk disrespectfully and
Right.
talk back. So I'm sure President Trump was very happy with his
Oh,
performance,
he
even
was
though
happy.
I thought it looked weak.
I have his statement at the end of the day, and I think his press secretary, that woman
Carolyn
who's
Levitt.
right, that child who's up there saying whatever they tell her to say. Um, wait, what did she say? I have it here somewhere. I mean, oh, here. She said Robert Kennedy Jr. is taking flack because he's over the target. I don't know what that means. White House Press Secretary Carolyn Levitt posted on the social platform X, quote, "The Trump administration is addressing root causes of chronic disease, embracing transparency in government, and championing gold standard science. Only the Democrats could attack that common sense effort."
Okay, so I have two things to say.
Total nonsense.
One thing is, Susan, you are the daughter of a bomber pilot. So you do know what it means to be over the target taking flak. It means you're
Yeah,
getting shot at because you're over the exact target. So what I
Got it.
think she's suggesting
That's
is that
what
he's doing what needs to be done. And so he's taking flak. But that's like his also saying that the women who testified on Capitol Hill, the survivors of Jeffrey Epstein, were a Democrat hoax, that they were
right.
perpetrating a hoax. So, yeah, I
This other
just
person,
disagree with both of those statements.
yeah, Taylor Budowich, she's the deputy chief
Yeah.
of staff in the White House, said that the Democrats appeared uninterested in health or human services, just parrots of a failed medical orthodoxy that has made America less healthy. Great hearing and preparation by the secretary. What is she smoking? I mean,
Yeah.
seriously.
Yeah.
Did she even hear what we heard? And then Vance also said that senators attempting to lecture Kennedy while supporting hormone therapy for children were, quote, full of shit, and everyone knows it.
Ooh.
I know. So, I mean, it's pretty incredible. There were some, I mean, if we have time, there were a couple of experts who really have a lot of important things to say.
In
Just
response to this, I assume.
yes, even before the actual hearing, but like Dr. Osterholm, who's a renowned person on vaccines, and I remember interviewing him during the pandemic. Here's what he said. To sum it up, really, we're right now in free fall in this country with regard to public health. Free fall, free fall. We basically are losing all the safety nets that we had with the public health system, and vaccines are at the heart of it. And of course, this administration is doing everything they can to eliminate, if not totally eliminate, vaccines for people. We're really at a point. He was talking to Anderson Cooper the other night, where we can either go with science and what we've accomplished in over 100 years of improving public health, or we can go with magic, smoke, and mirrors. And he's saying, for people with kids, it's going to be hard for families to make decisions what to do.
And the children who do get vaccinated will have fewer symptoms, but there is a 3 to 12% chance that they will get infected by their classmates who do not get vaccinated. And the teachers will be in danger. The parents will be in danger. And we will see an increase in measles, in mumps, in rubella, in you name it, every disease that is now protected against. And COVID, of course, as well.
Yeah, Florida is going to become a hotbed. People are saying that Disney World, people are not going to even take their kids there. It's scary. Paul Offit, who's also, you probably heard he was on the Vaccine Advisory Council and he's taken off. Just to remind people, we've had the biggest measles epidemic. We've had 2 children die of measles, which we haven't seen since 2003. 266 children died of influenza. We haven't seen numbers this big since 2009. That's one full pandemic. And we've had 10 babies die from whooping cough. The previous year, we had 2 babies die from whooping cough, and this year isn't even over. It's getting worse and worse, and I imagine next year will only be worse because we have a Secretary of Health and Human Services who's a virulent anti-vax activist. Why would we ever think this is going to get better?
Well, all I can say is I hope that any parent listening to that, any person listening to that, will take to the streets and march in protest. There's another King's Day, no King's Day, protest planned in September. And I hope that people will come out and let the government know that it wants to be safer than we are being held. Maybe one last question, Susan, on this topic, and that is the state of California, Oregon, and Washington have gotten together, and northeastern states, New York, Pennsylvania, are talking, New Hampshire, Vermont, I can't remember all the names of the states in the Northeast, are talking about doing this, are going to try to get together the statistics and the data and put it out so that people will have reliable information, the kind of information that we are being denied by the federal government, both in terms of labor statistics, where he didn't like this, Trump didn't like the statistics that came out, so he fired the person.
Yeah.
But do you think that can work? And even if they come out with good data and good recommendations and say that people should get the vaccine, will people be able to get the vaccine if it's not being paid for by Medicare, Medicaid, or by insurance companies?
And that's the big question because, Dr. Frieden, who was the director of the CDC before, and he said, it's a matter of him telling the truth or not. And there's no, what can you rely on? But here's the thing. So let's say that, there are all these recommendations that the states make. It's like what I said earlier. It's the CDC by law. They have to recommend it in order for the insurance companies to cover it. And, RFK.Jr talked around that a lot today.
Yes.
And he kept saying, oh, you can get vaccine. And a lot of the senators said, well, wait a minute, if the insurance companies aren't covering it, he was all over the place. And as you said, take to the streets. That's exactly what I came away with today. And then we had kind of a crazy conversation, Jill, you and I, a while ago about, well, what if he really is doing this, what if we all stop paying our taxes? What if everybody said, we're not going to pay for this anymore? You're going to kill our kids with measles. I mean, we're going to end up, it's settled science with measles, polio, tetanus has been eradicated, basically. And now we're at risk. I mean, it is a 5-alarm fire. I keep saying that. It's completely freaked me out. And I think, yes, we have to march and all that. But I think, I don't know, maybe something extreme like holding back your taxes. Is that crazy?
Well, let me just say, as a lawyer, I'm not recommending that.
No,
But as a human being, I have to say I'm sympathetic to that viewpoint. It would be an act of civil disobedience, and you'd have to be prepared to take the consequences. So maybe you want to rethink whether you're going to do that, as opposed to getting very active politically and making sure that the 2026 election turns out the Republicans in the House and the Senate and allows the Democrats to try to undo some of the damage that has been done.
Well, maybe he'll get fired. I mean, maybe this will, particularly when, Congress people, the senators.
When you say he, I assume you're meaning RFK.Jr. Well, yes.
Yep.
Of course, fired means either he could get fired by the president, but that's not going to happen. So what about impeachment? Why is no one talking impeachment?
Right. I know. Something has to be done. I mean, that's
the Republicans who voted for him are not happy anymore. They were questioning him very strictly today. So let's leave our audience with a thought that they need to be politically active, and maybe they need to encourage their members of Congress to start impeachment against this particular cabinet officer.
People need to remember, too, it's 6-month-old babies are hospitalized a lot for COVID, and so are pregnant women. Pregnant women, they're both most I can't say it.
Susceptible.
Yes. But, it's a lot to think about. I think, as each family starts to deal with this, sending your kid, you're a new mother with a new kid, sending him to school for the first time. It's bad enough we have to worry about, guns.
Guns, yes.
Now you have to worry about, deadly diseases. It's crazy.
Yeah. Well, I hope that the people listening to us will spread the word to their friends and family and to the friends who are MAGA supporters, and see if, at least on this issue, we can reach common ground. And if we can, it's a start toward reaching common ground on just the facts.